Awesome. Thank you so much, McKenna. It's nice to see you all. Like she said, definitely feel comfortable turning on your camera just so, I can see everybody and you can see me. Throughout my presentation, go ahead and put any questions and I'll answer them at the very end, just so we can kind of keep it going. But I wanted to talk about 10 things to know before you enter healthcare, and in any setting, if you're a secretary or a nurse, but I'll be speaking as a nurse. So let me share my screen, guys, and then we will start the presentation. Alrighty, so this is me. Hi, I'm Meg Harrell. I'm a nurse, and I've been a nurse for a very long time. I'm one of the old ones. Alrighty, so who am I? I am Meg Harrell, RN BSN. I'm a nurse educator, and I'm also a CVICU night shift zombie. I was born and raised in Miami, Florida, the 305. I went to school in Miami-Dade College and then went to nursing school at Florida International University, also in Miami. And I have a bachelor's in nursing. I don't have any plans to keep going. I'm pretty happy at this point. But who knows, maybe nurse practitioner or nurse anesthetist is in my future. Who knows? I've been in healthcare for 15 years and I've been a nurse for 12 years. I have experience pretty much everywhere. I've been in the ER, med-surg, pre-op, PCU, CVICU, step-down units. I've worked in nursing homes and memory care units, rehab centers, so many places. I've never worked in peds and OB, and I hope to never work in those departments. And over the years, I've really developed a passion for teaching the newbies and nursing students and really kind of like developing this next generation of nurses and finding all of their pain points and the things that I can really help this next generation with, especially now during the pandemic. I really feel like we're going to lose people if we don't really give them a good foundation during this time. So I'm going to talk about 10 things to know before entering healthcare. All right, so if you're interested in healthcare, you're going into it, you're kind of like getting your feet wet. These are the 10 things that I wish I knew before getting into this type of field. So number one is you need to know how to have a good laugh. So healthcare workers, we are known for our sense of humor because it is maybe a little twisted, maybe it's a little sadistic. And I think humor in healthcare really is a coping mechanism. With everything, you just need to take it in strides, know how to laugh when things go wrong, and it's really going to help you through your shift. And it is a great way to de-stress after a long shift, after a really traumatic thing that's happened. Knowing how to have a good sense of humor and how to have a good laugh about things. You don't have to stay serious in healthcare. Please don't. All right, number two is you'll feel tired, underpaid, and overwhelmed. It will probably go in a cycle. You'll feel super motivated, super passionate, and then you'll be working too much. You might pick up a bunch of extra shifts and then you'll start to feel low. You're going to feel tired. Oh, I don't get paid enough for this, no matter what position you have, and feeling overwhelmed with your daily responsibilities. There is a lot of work to do, whether you're at the bottom or at the top in healthcare. And it's very easy to feel overwhelmed in this type of field. And emotion can sometimes push you to the edge. And the best part about healthcare is that you're not alone. Nobody is sitting in a room taking care of a patient by themselves. It's really important to rely on your coworkers and to lean on each other. Developing a team mentality wherever you are working, whether it be an office or a hospital floor, developing a beautiful culture is really important for when you are feeling tired, underpaid, and overwhelmed. Relying on each other is what's going to help you survive the best of times and the worst of times. Number three is this requires passion. So if you're not really passionate about the position that you're getting into, really passionate about how the human body works, the science behind it, seeing people heal, if that doesn't get you excited, get out now. Okay. Please. Um, the passion behind healthcare and the reasons why you get into it is what is going to keep you going. So I really want everybody who's considering a job or a career in healthcare to really stop and ask themselves what inspired them to go into this field. What fascinates you about healthcare, about maybe just human anatomy and physiology? Hang on to those best parts. I'd love to hear stories from my students who are talking about, well, I had childhood cancer and the nurses were the best part of my journey. And now I want to be a nurse and provide that kind of care and love and joy to other people. And some people have family members who they had to take care of. And they said, being a caregiver in that role really awakened something in me. That's what I want to do. So find that little piece and that little passion and hold on to it, because this is what's going to get you through. It's what's going to motivate you. It's what's going to bring you joy. Number 4 is the recipe for survival is balance. So I think this applies to every career, every type of job you can ever have. You need to have balance. There is work, there is family, there is health. You need to learn how to prioritize not just your patients' needs, but your own needs. So learn how to take care of yourself, learn when it's okay to pick up extra shifts, learn when you need to say no, and learn that your job is not your entire identity. So definitely learn how to balance your life, because it's really easy to get wrapped up in healthcare. It's really rewarding and you'll love to do it and you'll want to pick up all the extra shifts and you will be needed. So it feels good to be needed. And it's really easy to maybe throw yourself into the career too much and not be taking care of your own needs. So that's why I think that finding a balance and reevaluating that every single month is the perfect recipe to survive. Number 5 is it's okay to not know everything. So when I train brand new nurses out of school, they just went to school for 2 years or 4 years, and now they're entering the workspace and they are so embarrassed and ashamed when they don't know something. Let's say it's a lab value or it's a certain medical term, and they feel so scared and ashamed that they don't know it. And I tell everyone, every day is going to be a learning experience. You're not supposed to know everything. So take that off the plate, take that off of your shoulders. It doesn't matter if you went to school for 2 years or for 6 years. It's okay to not know everything. Some things are going to stick for some people and other things it won't. And it's okay to Google. Okay, that's why Google exists. It's okay to Google things before you enter a patient's room. Refresh your memory about side effects on a drug, maybe the trade name and the generic name of it, and constantly be asking questions. I still ask questions. I still had to ask questions about the other night we had a patient who we were deciding when to give the sedative and the paralytic, and I had to ask, hold on, which one did you order? Which one are we doing first? The sedative always goes before the paralytic. And I still had to ask, and I've been a nurse for 12 years, constantly be asking questions. Be humble enough to always be asking questions, because people's lives are in your hands and you don't have room to be prideful. So it's okay to not know everything. Stay informed, but always be open to more information. All right, number 6 is you will develop a relationship with death. That sounds really creepy and weird, but when you're in healthcare, you're going to see death. You're going to have to predict death. You will fight off death. You will comfort before and after. You will mourn death, and you'll witness the entire process. and you will develop ideas and beliefs and a relationship with death. My personal experience before I went into healthcare, I was very scared of death. I was petrified to die. But now that I've worked in healthcare and I've taken care of hospice patients, I've taken care of people who were very happy to die. They felt very accomplished with their life. They felt like it was the next step and they were okay with it. And seeing people peacefully let go. I've also seen people who were at the end of the dying process and they were talking to people that I couldn't see, and they seemed really happy and peaceful. And my personal experience and relationship with death is that I no longer fear it. I think it is like a huge process, but I don't think anyone ever goes through it alone. So whatever the process is, whatever comes after this, I no longer fear it. And everybody that I know that I've talked to about death in healthcare has always been forced to evaluate their beliefs with that and around death. So just be aware of that is something that is coming. And this kind of transitions into number 7, that healthcare will challenge or affirm your spiritual beliefs. So on my TikTok channel, I have a whole segment called The Creepiest Things That Have Ever Happened to Me as a Nurse. So in this series, I tell paranormal stories that have happened to me and creepy, unexplained things that have happened to me and my friends at work. And it really makes you think about, like, are ghosts real? Is there a spirit world? Is this all psychosomatic? Do we make this stuff up? Are we just trying to explain things? You will be challenged to sort of like evaluate your own spirituality the longer that you are in healthcare and the longer that you take care of people. So I think it's really something that you need to be aware of and something that you need to embrace and accept to really like explore that. And I think if you are a spiritual person, it may really challenge what you believe, or it's really going to affirm your beliefs wherever you are in your spiritual journey. So if you are interested in creepy stories, I would love to tell them. You can go watch them on any of my channels, or I would love to hear yours because I'm like obsessed with creepy hospital stories. Let's move on to number 8. So number 8, you will meet the best and the worst of humanity, especially if you work in the ER. Okay, guys, I worked in the ER for 4 years. I'm really happy to have moved on from that. It was really draining and challenging, but it was one of my most treasured years as a nurse. You're going to meet some of the sweetest people, and you're also going to meet some of the most evil people that you could ever imagine. You're going to see all spectrums in healthcare. Healthcare is unique because of how extreme these situations can be. I mean, you'll see life. I've watched a baby be delivered in the ER, and it was so happy and wonderful. And, you know, the baby was healthy, the mom was healthy, and it was really crazy to see a person being born. But you also see death, you also see defeat, and you see the triumph of all the range of emotions and possibilities that can happen for humanity and in healthcare. And because you see all the possibilities in humanity, I personally believe after seeing all of that, that there really is more good in the world than there is evil. And that's been my personal experience working in ERs all across America, and especially in some really big cities like Chicago and Miami. You'll see some of the worst and you'll see some of the best, but I personally believe there is more good in the world. That has been my personal belief and my conclusion. Number 9, healthcare trauma is real. And what I mean by this is that the trauma to the workers, the nurse trauma, the things that you will witness, it is real. And it's something that doesn't get talked about enough, and it's something that doesn't get addressed enough. So I really wanted to add this in and talk about it. So we're going to live through some things and some trauma. We're going to see things that are very difficult to see and very traumatic. And when you are at work, everybody puts on a brave face, and you're wearing the uniform, you're wearing the badge, and you don't break down, you don't cry, but you're still absorbing all of that trauma. I think it's really important to identify it. And if there is, let's say, a topic you're really sensitive about, or something that is triggering you, something that you can't stop thinking about, something that you dream of often, or something that when it's brought up or you take care of a certain type of patient, it shuts you down emotionally. Identify that trauma, because those are some of the signs and symptoms, and really connect with yourself and identify it. You can't heal it if you don't highlight and identify it first. And then you need to really give yourself time to process. Once you identify it, you can't just say, okay, well, I'm healed, I'll be good. It really does take time to identify it, feel it, and then begin the healing process. And I suggest to start by talking about it out loud to maybe a really close, good friend who will listen. For me, it's my coworkers, because they understand just the insanity of healthcare. So it's really helpful for me to talk out my shift, talk out traumatic experiences with my coworkers. And then lastly, I really recommend that you find a professional to help guide you through the healing process, a psychologist or a psychiatrist who is very well versed in understanding people, learning about somebody, and then helping you through that healing process. I really highly recommend that. I think for every healthcare worker, they should get therapy at some point in their career, because I think we all know, those old crusty nurses who are burnt out and bitter, and it's because they never healed their trauma. Moving on. The last thing I want to talk about is that your career doesn't end when you leave the hospital, if you work in the hospital setting. So you're going to be changed by the healthcare profession. Being a healthcare provider means that you're always observing. So you're going to be observing people and things and situations like you never did before. You're going to have like this problem solving hat that you always have on, and you're always going to want to be solving the problems around you. And then there's also this like goal setting thing that happens. You're always setting goals for your patients. You're always setting goals for your shift. And that's going to bleed out into the rest of your life, pun intended. So there's also some really positive things that come with being in healthcare. For me personally, I've become so much more confident. I was so timid and shy growing up, but being good at this one little thing and developing skills and doing it for so long, it's built so much confidence in me. It's definitely improved my people skills and my discernment in real life with real humans. Healthcare, I think healthcare is a lifestyle, and you're going to be more prepared in life the longer that you are in healthcare, because you're used to, I don't want to curse, but like when hits the fan, you're going to be used to that. And then when it happens in real life, you're just so much more prepared for that sort of fight or flight. Let's observe, let's problem solve, and let's fix this. So let's move on a bit. I did want to put a slide really quick if anybody wants to connect after this. I have a website, nursemegrn.com. I have a TikTok where I tell stories, I give really helpful advice, and then it's also just a lot of like healthcare humor. I also have an Instagram and a YouTube channel where I put out a new video every single Friday. Some of it is haunted hospital stories, some of it is how to survive your first year of nursing, and some of it is for nursing school students who really just need support on how to not get burned out, how to write a great care plan, things like that. And then, of course, you can always email me at support@nursemegrn.com if you have any questions or anything like that, or if you just want direction in your healthcare journey. I want to definitely assure you that you have made an excellent choice if you are considering healthcare. It's going to be one of the most rewarding things that you ever do with this precious gift of life that you have been given. So thank you. If you're joining the healthcare ranks, thank you for joining the ranks and being part of healthcare.
Awesome. So if you guys have any questions, go ahead and drop them in the chat. Thank you so much for speaking to us. I loved listening to that. I think you talked about a lot of things that don't get addressed as much as they should. So
yeah, I think a lot of people that talk about healthcare to people that are considering it are either extreme, like they're very flowery, like it's so great, or they're like, it's terrible, you're going to be burnt out all the time. And it really isn't extreme all the time. There's some really beautiful things and there is some difficult things, but it's worth going into. And I think that's like the biggest message.
awesome. I don't see any questions. I will go ahead before I forget and post this link to the Google Form. So make sure if you want a certificate to fill that out. Yeah, I don't think I have any questions. Just once again, thank you so much. And thank you everybody for joining us today.
Yeah.
Yeah, so, oh, there's one.
Oh, awesome questions. Okay, so Myra says, why did you become a nurse? Was there a specific event or reason? That is a good question. So I personally became a nurse because my dad is a nurse. He went into nursing back in the 80s and he really felt a heart. He had a lot of friends and things that were dealing with like the AIDS crisis, and he really wanted to get into healthcare and help people. So he got into nursing. And so growing up, he was working in the hospital, but he was also working in home health. And I would see him going into patients' houses, starting IVs. I was very comfortable around like medical equipment, seeing blood, the smells of a hospital. I was very comfortable with that. And he always encouraged me and made me feel like it was something I could do if I was interested in it. So that's why I became a nurse. I just knew right out of high school, I went pretty early. I was like, this is what I'm doing. And I did it. I didn't get into nursing school right away. I applied to about 4 or 5 different colleges and did not get in. I'm not a super academic person, so I didn't have straight A's or anything like that. So what I did was I did LPN first. So I got my licensed practical nurse certificate first, and then I worked for a little bit, and then I got my RN. There's like a bridge program, and then I worked for a little bit, and then I got my BSN after that. So I do want to encourage everybody that like everyone's journey is going to look different. I went to nursing school with people in their 60s that they were just starting their 3rd career. So don't ever be discouraged on whatever roadblocks that life is going to send you. Your journey is not supposed to look like anyone else's. Okay, so but if you have a goal, keep working towards that goal.
Awesome, that's so true. Somebody sent a question in, and it says, how long did you work in the hospital as a nurse when you first started?
Oh, awesome question. So when I first started, I started out in a cardiac unit, and I thankfully got day shift, which was a really big deal. I guess a lot of the new people, like a decade or so ago, a lot of the new nurses had to work night shift. That was kind of like how it would work. And then if you were good or worked enough time, you could switch to day shift. But I got a day shift position in the cardiac floor, and I worked full time, and I would pick up an extra shift every 2 weeks. And if they were short or needed me to stay, I would always stay and always pick up. I didn't have any kids. I was newly married. I didn't have like a ton of responsibility in life. It was my mid 20s. So I worked probably too much, and didn't know when to say no and when to have a balance. And I got burnt out pretty quick, in my like second or third year, where I had to take a step back and say, all right, let me really put some boundaries. I do think it is great to pick up extra shifts at the beginning, maybe not as often as I did, but as a new nurse, the more that you are exposed to medications, to diagnoses, to procedures, the more that you soak it in, especially in your first 2 years. So I always suggest new nurses pick up an extra shift, maybe once a month, if you can handle it, mentally, emotionally, and physically. But yeah, I hope that answers the question. That's how much I worked at the very beginning. Okay, so McKenna, I'm looking for an ABSN program that does not have a preceptorship. Pros or cons? All right, so a lot of programs will offer preceptorships in their last semester. I really want to let people know that the majority of school is just an introduction. Nursing school, they just give you the dots. They're showing you the dots. None of those dots will connect until you are actually on the floor with your badge, seeing the patients. That's when all of the dots begin to connect. So I think that a preceptorship in your last semester is great. I don't think it's completely necessary. I do think a great orientation is more important. So when you are interviewing for a job and you are looking to say yes to a position, make sure that you are very clear or get very clear in writing how much orientation you should get. You should always be having 8 weeks or more orientation on the floor. I have sadly seen in the hospital right here where nurses are training for a couple of shifts and then they're just left on their own, and we're short staffed, you have to take a patient load, don't worry, we'll give you easy patients. It's a recipe for disaster. Always fight for at least 8 weeks of orientation. So a preceptorship is great, but because when you're still a student you don't have as many privileges and you don't get to like get dirty and do the real nursing work until you do have your license and until you are hired. So I think it's okay. I think it's great. I don't think it's completely necessary. Focus more on orientation after you are hired. Really fight for that. What are some of your most memorable cases and patients? Oh, I have a lot of stories. Um, I love to tell stories on my TikTok. I just recently told a story about, okay, I'll tell you a happy story and I'll tell you a horrifying story. So let's start with the horrifying story and then I'll end with a happy story. So I was working in the ER and this poor gentleman who was experiencing homelessness came in a wheelchair. He hadn't walked for years and he said, my leg hurts. I haven't taken off my boots in years. Can you look at my foot? Okay, we'll look at your foot. We couldn't get like the boot off. Like it was leather. And I guess just being in the elements, even though we untied it, I couldn't get it off. So we had to cut it off with trauma scissors. And his foot had such a bad infection and was so gangrenous that when we slipped the boot off, most of his foot came with it. And it was full of maggots and it was the craziest thing. It was also the worst smell I've ever smelled. Like I can smell it right now. It's still in the back of my brain. And this guy, he was like, huh. He was not phased at all. And all of us were freaking out. But of course, healthcare workers are the best actors. So we're like, oh my gosh, sir, you're going to need some antibiotics. We need to admit you. We may have to amputate further. And he was like, oh, it's not as bad as I thought it was going to be. Horrifying. Like, that's the worst thing that I've ever seen and smelled in the ER. But he was admitted and taken care of. I don't know what happened afterwards, but he was admitted and well taken care of. I'm glad he finally came to the ER. And then I'll tell you a happy story. So I was taking care of this gentleman. He was end stage pancreatic cancer and, or no, liver failure and liver cancer. So he was very close to death, and he didn't have family, but we set up hospice and stuff like that. And I was asking him, like, is there anything you want while you're here? Like, anything like special? Do you want something from the kitchen? And he said, all I want is to see my dog and have a beer and a pizza one last time. And I was like, oh my gosh, that's so like, I didn't know he had pets at home. So I talked to my charge nurse, who talked to my manager, who talked to administrator, who arranged with his neighbor to bring his dog in. Thankfully, it was a small dog. Bring his dog in for the last day or two to just be with him in his bed. And I got a doctor's order to get him a can of beer, and I ordered him pizza from across the street. There's a Pizza Hut across the street from the hospital. And after my shift, I just sat and ate pizza with him, and he drank his beer and he had his dog. And it was like the most beautiful moment. He was so full of joy. It was my first patient that I ever had that passed away. He passed away the next day, or 2 days after that. But it was such a beautiful, beautiful moment, where usually the hospital is so cold and it's not personal, and there's bad news. It was such a beautiful moment with that guy, and I'll always remember that. Okay, there's a few more questions. Do you think doctors or nurses interact more with patients face to face? Nurses interact. So in real life, not Grey's Anatomy, in real life, let's say on a regular, let's say a telemetry floor. So patients are on a cardiac monitor. Each nurse has 4 or 5 patients, and you have those patients for 12 hours, and another nurse has them for 12 hours. Another nurse has them for 12 hours. Now, let's say they don't have any consulting physicians. Maybe they have a cardiologist. They don't have a renal doctor. They don't have a pulmonologist. They just have the intensivist, the internal medicine doctor. That doctor will only come once a day, once in 24 hours. And typically they will be in the room maybe 5 minutes. So in reality, if the patient is in the hospital 23 hours and 55 minutes of the day, it is the nurses who are going in. It's the tech that's going in. Those are the eyes that are on the patient. That is who the patient is seeing face to face. And they will see the doctor for about 5 minutes, because that's just how it works. The doctor is available over the phone if we need them. But in reality, if you stop breathing or if your heart stops, it is the nurse who is going to be administering epi to restart your heart, who is going to start compressions, who is going to put on the oxygen, hook you up to the monitor, resuscitate you way before the doctor shows up. So nurses will see patients more face to face in real life. How did you find your why for healthcare, and how do you recommend students to? I knew I wanted to be a nurse because I felt like I could do it. I was very encouraged by my family. I felt very comfortable around medical stuff, where other people in my family were really grossed out about blood and they couldn't even hear stories. And I felt very comfortable. So I thought, this is going to be okay. This is kind of where I should go. But the longer I was in it, my why became seeing the healing process. I remember getting a patient who had open heart surgery, and it was very unexpected. Came to the ER with like chest pains, had a heart attack, or had a STEMI, and they did a cath. All 4 coronary arteries blocked, had to have open heart surgery, bypass times 4, and then his sternum, where they break open the sternum to do the surgery, it got infected. So they had to re-go in there, do packing, sew up the sternum again. He was in such bad shape, and he was young. He was in his late 50s. And I really thought he was not going to make it. Every day he seemed to get worse. And then I was off for a little while. I had taken care of other patients. And then one day I had him again. It was probably a month later. And it was his discharge day. And I could not believe that this guy made it. He was motivated to get better. And it was such an incredible feeling to wheel out a patient that you thought was not going to make it. Seeing that healing process and seeing somebody like take hold of their health and you being a part of that healing process, that became my why. I wanted to see more people heal and get better. And I wanted to wheel more patients out the door better than they came in. So that really became my why. So that's a really good question. Thank you for asking that. I like your emoji, Myra.
I will let it sit for a minute to see if anybody is typing any other questions, but I will go ahead and put the link to that Google form in again so that you guys can look at it. I can't stop thinking about that guy with the boot and the maggots.
Yeah, it was definitely the grossest thing that I had ever seen. I really didn't think it was that big of a deal. I had told that story to my family before, to like, we had all talked about it, and it probably wasn't even the craziest thing I saw that shift. But for some reason, when I told that story on TikTok, it blew up and went so viral. I was like, that really wasn't that gross, but I guess it is really gross if you don't work in the ER and see
it all the time. Yeah.
Those things often. I was also thinking of doing a series of like the craziest things that I've seen pulled out of people that people
oh my God. Yeah.
have inserted. Yeah, that'd be a fun
really funny. Not for them, but interesting is a better word.
Really like, wow, you see everything. You see all spectrums of humanity. Oh, okay. So Myra asked, you mentioned earlier that you probably don't want to work in pediatrics. I'm curious why. This one time I was floated to the pediatric ER and I could not emotionally handle it. So I couldn't start an IV in a child. I just couldn't. And then hearing babies cry. I don't know if you've ever seen what they put a little, like a toddler or a baby in to take an x-ray, but it's essentially like this plastic tube, and they have to put their hands up and they're just in the tube to get the full spectrum of the ribs and the lungs. But like, kids don't understand that you're just trying to help them. They just know that hurts. Like, you're putting a needle in my arm. I could not handle seeing any type of suffering in children at all. It like broke me emotionally, and I couldn't do it. So I asked them to never ever float me ever again. And I knew that I could never handle a pediatric floor. I could never do it.
Is that the same reason that you didn't want to do OB too, or is that just different?
Oh, I just always thought it was a little, I thought it was gross.
Yeah.
It's not so bad. And I've had 2 children, and even through the process, I was like, oh, this is gross.
I get it. That's so funny.
It's just not for me. I tried lots of different departments. My specialty is cardiac. I love cardiac. That's where I want to be. I did dabble. I switched to a neuro floor a couple years ago, and I switched right back. Just cardiac is where I'm supposed to be.
Awesome. Love that. Let's see. I don't think anybody else has sent like a personal message to me one that we missed. So those are all great questions. I don't have any more questions, but you guys do. Feel free.
Yeah, this was awesome. Thank you so much for like asking, and even like the personal questions. Thank you so much.
Yeah, thank you so much for talking to us. I'm sure I speak for everybody when I say that we all thoroughly enjoyed it. So,
Oh, good. Yeah, feel free to like find me on social media or email me if you have any like questions about your own personal journey in healthcare, even if it's not nursing related. I'd love to just help guide you and answer any questions.
awesome. Well, thank you so much. I'm going to go ahead and send the link to this again. But if that's all that you have and there's no more questions, you guys are free to go.
Alrighty. Thank you so much, guys. I hope everybody has a good weekend.
You too. Thank you.